Welcome to another edition of the Invisible Wheelchair Interview Podcast. I'm Donald Grodoff, family coach with FamilyOCD.com, FocusedHealthyFamily.com, and of course, InvisibleWheelchair.com. In the Invisible Wheelchair interviews, I get the wonderful chance to interview some of the experts with obsessive-compulsive disorders, professionals that treat OCD, people who are going through or have been through OCD, parents and caregivers of those suffering from OCD, and of course anyone that advocates for treatment of OCD. My goal of these interviews is to inform people on all aspects of OCD and bring about awareness of obsessive-compulsive disorder. Please remember that I am not a doctor, therapist, or counselor, and the content, information, resources, and ideas that are talked about and brought up here in these interviews are not necessarily the views and opinions of myself, Family OCD, Focused Healthy Family, and Invisible Wheelchair Podcast, and I always recommend to seek additional professional help in finding solutions for yourself. You can find out more about me at FamilyOCD.com, FocusedHealthyFamily.com, and InvisibleWheelchair.com. This interview podcast was recorded September 14th, 2018. I'm honored and privileged today to interview a doctor that I both work with and admire. It's Dr. Kristien Boyle. Dr. Boyle is the founder of the Holistic Wellness Center of the Carolinas, where he is the director of functional medicine. He holds a diplomate in Oriental medicine. He is a licensed acupuncturist and a functional medicine practitioner. His postgraduate focus has been in the fields of functional neurology, functional immunology, and functional endocrinology. Dr. Boyle studies the complex interactions among genetic, environmental, and lifestyle factors that influences a person's long-term health. As a result, his approach to each clinic member is highly unique and specific to the individual's needs and goals. He is a diplomate in Oriental medicine, which is awarded by the National Certification Commission for Acupuncture and Oriental Medicine, when all 4 national board exams, acupuncture, herbology, Western biomedicine, and Chinese medicine, are successfully passed. His additional training includes certificates in neuroacupuncture and acupoint, homeopathic and vitamin injection therapy. Dr. Boyle is also certified tension point therapist. He has also completed advanced training in the management of Hashimoto's and other hypothyroid disorders, incorporating functional medicine with Oriental medicine. His passion is helping patients with thyroid disorders, Hashimoto's, autoimmune conditions, diabetes, digestive disorders, female endocrine dysfunctions, and adrenal disorders using research-based functional medicine. Dr. Boyle is married with 2 kids, living and working in Fort Mill, South Carolina. To find out more information, let's go to that interview now. Well, Dr. Boyle, I really want to welcome you and thank you for being part of the Invisible Wheelchair Podcast.
I appreciate the opportunity, Don. Thank you for having me.
And Dr. Boyle, what I do for my audience, I like to give them a personal feel of who you are. So I ask my interviewees to share a story of some sort with the audience.
Well, I guess why don't we start off with why I got into what I'm doing. And I'm from a really glamorous place called Reading, England, which is about 30 minutes from London, and pretty much everyone grows up to wanting to be a professional football player from where I'm from. I ended up actually wanting to play golf. I was pretty serious with my golf, so I took a bit of a U-turn, and I got pretty good, and but ultimately we found out later that Crohn's disease was kind of ravishing my life and my potential golf career at the time, so I had to quit at an early age, and that's where I guess everything started. I started becoming really passionate about looking after myself and managing my Crohn's disease, because in England and when I moved to America when I was 16, the Conventional system really just wanted to prescribe drugs for me and to suppress the symptoms, and they never really wanted to really truly address it. And the long-term goals were really just to stay on medications the rest of my life, and I thought that was unacceptable. So luckily at the time, my mother married someone who practiced functional medicine as well, and we got me better. Obviously, right now I'm not a professional golfer, so I didn't go back to golf, but that's really where it all started. And I've now been symptom-free with my Crohn's disease for around 9 years. So that's why I do what I do, and why I love to share my passion with other patients, specifically with autoimmune disorders.
You mentioned in there that, and in the bio, I also mentioned a functional medicine practitioner. Can you explain what that means to be a functional medicine practitioner or a doctor?
Okay, yeah. I mean, I guess the difference is really in philosophy between conventional medicine and functional medicine. Whereas conventional medicine is going to label a diagnosis or a condition, whether it's Crohn's disease or MS or OCD, and prescribe drugs to manage the symptoms. Functional medicine is going to look at, what are the reasons why this person has Crohn's disease or OCD? How do we manage the underlying causes so there's less of an expression of this condition? It's kind of similar to, I like to use a great analogy that Kristien uses all the time, so I want to give him credit. It's kind of like a rock in a shoe, whereas you got this pain in your foot, but you find out there's a rock in the shoe. Conventional medicine then might prescribe you an anti-inflammatory for the pain. In functional medicine, we want to take the shoe off, get rid of the rock so you can put it back on and you don't have any pain.
That's a great analogy. I like that.
Yeah, that's a good one, huh?
Maybe you could help to, I think we've kind of defined what a medical doctor does versus what you do. Well, I think medical doctors also really pin down to a certain area of the body or whatever. You have your cardiologist, you have your bone doctor, etc. Whereas in functional medicine, if I'm not mistaken, you are looking at really the whole body, the whole environment of the person that you're dealing with. Would you say that's correct?
Yeah, and in some ways there's a lot of similarity, of course, with conventional and functional medicine. That we both use advanced diagnostic tests to figure out how the approach we want to incorporate. But in conventional medicine, they're phenomenal, and I want to be clear, they're really phenomenal at managing, acute kind of crisis conditions, and they are, like you said, specialists in different pieces of your body. So if you have a heart attack or a broken bone, you need to go to a hospital. Some functional doctors not going to be able to help you with that, whereas we're going to look at more of the whole body and address more chronic conditions versus acute crisis conditions.
So you mentioned in that about testing and kind of getting to the root cause of something. So could you explain more or go more into about your testing procedures and how that helps you?
What I like to tell patients when I first meet them is, there's not one or two or three or four reasons why you're sitting in front of me. Normally there's about 20 to 25. Ultimately, the name we give your condition, whether it's MS or Hashimoto's or Crohn's or OCD, is a name, right? We need to know all the reasons why you have the condition, all those little 20 or 25 reasons. So detailed, expansive testing is really necessary, because otherwise we're just guessing. Why don't we, talk about OCD as an example, and we could take it from there. But with an OCD patient, we want to figure out, again, there's always going to be a genetic component for these conditions. So we want to find out what genetic factors are playing a role with their condition. We'd want to run some genetic testing to rule out, are they breaking down catecholamines effectively? Are they not breaking down their serotonin effectively, ultimately impacting their OCD? With the environmental factors, we'll find out through further testing as well. So to begin with, we always start with genetic testing. And how can we customize the patient's diet and other protocols to manage those? And then we want to look at typical other standard chemistries, what foods they're sensitive to, other genetic conditions that can cause nutrient deficiencies, and so on.
That's wonderful. We, went through that ourselves with getting into, I always just said we went into deeper testing because we had to find out the serotonin levels, the GABA levels, all of that. So that makes a lot of sense to me, especially because we've been through it. One of the things I always like to point out, and maybe you can expand on this, one of the things that I've seen, even in the work I do, is that people don't quite get it when it comes to more natural medicines, because they take longer to, I'm to see the results to it. So people get a little impatient with that, versus when they get a medicine, they see pretty quick results. Or it can come across faster, but it's really the long term that the natural medicine really does its best. Maybe you can clarify that a little bit more and talk a little bit about that?
Yeah, and it all depends. Sometimes you can see quick results. It depends on the patient. Some really long-standing chronic conditions can turn around pretty quickly, but the majority of the time, you're right, it's going to take a while to address all those root causes, a while to figure out the root causes. Some tests don't come back for a few weeks, right? So, and then when we prescribe the medication or the supplements, it can take time to change the function underneath the surface versus just quickly changing the biochemistry to address a symptom.
So leading from that, what are some of the, I guess you might say, objections you run into, or the responses that you get from patients? Do you find some regular objections that you come across?
Normally that's why we do a lot of pre-education before someone becomes one of our patients. We set the right expectations that, we don't know how long it's going to take for this to turn your case around. And at our clinic, we're really passionate about teaching the patient to understand why they have the condition, what we can do about it, and ultimately giving them that independence so that they can continue to work on it on their own, because it can take a while. If someone has been sick for 20 years, it can take a couple of years to start turning things around. So for us, we don't typically get it too much, because we're pre-educating them with the right expectations that, you've done it the old way, you've seen symptoms change quickly, but maybe experience a lot of side effects. And ultimately, you're still where you were 10 years ago. Now we have to address the root causes, and there's no really guarantees on how quickly it can change. But if we truly look at the root causes and start to understand why you have this condition, it gives you the opportunity to turn it around. So the benefits are great long term, but sometimes you're right, it can take time, of course.
And maybe if you would explain to the audience some of the issues that your center is focused on. I know you deal with, like you said, Crohn's disease. What are some of the other, issues or problems that you specifically deal with at your center?
In a nutshell, it's really all of the patients who kind of fall between the medical cracks, so to speak, and complex chronic conditions that no one else is really helping them with. So we're pretty well versed in a variety of conditions, such as autoimmune conditions, which I would probably say the majority of our patients are patients with autoimmune conditions such as MS and Crohn's and Hashimoto's and myasthenia gravis and so on. We see a lot of infectious diseases, whether it's tick-borne illnesses and hormone imbalances and neurological conditions, including anxiety and OCD.
And if you would, can you explain kind of what the process looks like that a patient goes through from start to finish?
Yeah. Let's. So a patient will come in. We'll customize an approach based on their history, their goals, and create a program of care where patients see us from anywhere from 4 months to a year and a half, where it's kind of all inclusive and we do whatever we need. And we're initially going to start off with some very detailed blood chemistry to get a foundation, and that will help us choose or adjust what I call secondary kind of exploratory tests, whether we check genetics, infections, how to customize their diet with a food sensitivity test, and how to address other autoimmune disorders, and whatever the secondary tests identify. Then we move through helping them change their diet and lifestyle, and we coach them through that. We teach them all the reasons why they feel the way they do, repeat the testing, and observe the changes and send them on their way.
And you have 3 different doctors in yourself and 2 other doctors in your practice. Do you find that that's good for balancing? Because I know one of the doctors is a medical doctor, and you've brought her into the practice. Can you explain that dynamics of how those doctors work together?
It's a lot of fun. The medical doctor specifically does stand-up comedy on the weekends, so she's hilarious. And Dr. Matz is funny in his own right. So on Mondays, we get together for the first half of the day, where we set aside hours to review labs, review all the cases together as a team. We all have different expertise, and although we all do functional medicine, we all have different opinions. So we work together on cases and come up with a plan. And then the rest of the week, we see our patients.
And Dr. Myers is a DO, a doctor of osteopathics, correct?
Right, and Dr. Matz is a chiropractor.
And yourself, you're well-versed in Chinese medicine too, if I'm not mistaken, correct?
Correct. So initially I'm a doctor of Oriental medicine, although I don't really do too much traditional Chinese medicine anymore. I don't think I've done acupuncture in about 5 years, but and we occasionally use some Chinese herbal principles with some patients. But you know, the initial philosophy of Oriental medicine is basically very similar to functional medicine. They kind of go hand in hand, where you want to address the systems within the body, the whole body, and so they're very similar in a way. But I don't use too much of the treatment principles anymore.
So, Dr. Boyle, is there any other message that you would like to get out to my audience?
Yeah, I want to talk about some more specific things with anxiety and OCD that could be really helpful, and specifically diagnostic differentiations between patients with anxiety and OCD and maybe some of the causes, because everyone's really different. There's no one case the same. You know, those 20 or 25 underlying causes will all be totally different. So I'd like to just run through some points or some things that they can think about, maybe research with their own doctors and look into themselves. So again, no matter what the triggering environmental factor is, there's typically a genetic component, especially with OCD. Going to whether it's 23andMe or Ancestry.com and then utilizing the raw data to break down the SNPs, that would be a really good starting block, because if you did have, like I mentioned earlier, something like a COMT mutation and you can't break down catecholamines, that person's going to typically, when triggered, have a lot more anxiety and OCD tendencies. The environmental factors may be a blood sugar swing, or they may be low in progesterone. So when their hormones are out of balance, their genetics are more expressed, and then they have more OCD patterns. You could have a MAO SNP, an MAO SNP, which impacts overall breakdown of all neurotransmitters, but especially serotonin. And most of the listeners are aware of how much serotonin impacts your OCD tendencies. And then again, another hormone imbalance like estrogen will impact your serotonin levels. So when your hormones are out of balance, then it plays a role with how your genetics are expressed too. A lot of things we commonly see with OCD are patients with SNPs to things that break down your histamine. So histamine, when high, impacts your brain chemistry and can cause anxiety, racing thoughts, and OCD tendencies too. So those are kind of some foundational, and there's many more, but those are some really important SNPs, genetic shifts in some of the genome that can contribute to a risk factor of OCD. A lot of other things I'd like to mention would be just nutrient deficiencies, especially triggered by genetics too. There's a condition called pyroluria, cryptopyroles or pyroluria, or MAR factor. There's a few different names for it, but ultimately these patients become, typically due to genetics, sometimes drugs. They produce too many pyroles which bind to nutrients. The nutrients become deficient, and it doesn't matter how much how perfect your diet is or how well you absorb your food, they become too deficient to offset it. And these nutrients all impact brain chemistry, like zinc, B6, manganese, magnesium, niacinamide, biotin. And as some of your patients may already, or sorry, some of your listeners may already know, all of these will impact brain chemistry pretty severely. Some other things we like to look at in these cases would be kind of what you said earlier that you did with your daughter. We want to figure out what's going on in the fight or flight part of the brain. Why would someone be on edge the whole time? And that could be anything from an autoimmune disorder to enzymes that help you make GABA, which are called GAD antibodies. You could have cerebellum issues where the cerebellum doesn't quiet down the fight or flight part of the brain, and anything that can just raise glutamate, really. So infections, chemicals, food intolerances, just general autoimmune disorders, all of these will cause the fight or flight part of the brain to be more active. You'll have higher glutamate levels and ultimately have more racing thoughts, anxiety, and risk of kind of OCD. Some last couple of things to mention, other than more obvious things, would be trauma as well, right? So if someone's gone through trauma and they have that genetic risk for anxiety and OCD, they're going to have a heightened, more exacerbated fight or flight part of the brain where the brain has been trained to respond to stress in a hyperactive state. And it'll be very hard for them to kind of unwind it without certain tools and techniques. And of course, there's many more, but those will be some of the main really key points I would like to get across to your listeners.
Through what you've just talked about, do you feel like you can either bring OCD to a manageable state, or, now I don't know if I want to go as far as saying cured, but do you believe that it'll really bring it down to a place where it's almost like it's cured?
So technically, like, you're right. If there's a genetic expression, you can't obviously cure that. There's always going to be a tendency to be at least an overthinker and a worrier and have some OCD tendencies. So I would like to say more manageable, but to the point where you can utilize those OCD tendencies to your benefit, right? It's not all completely negative. A lot of OCD people can be very detail oriented and very successful when it's under control and managed, right? We just want to give the patient the opportunity to kind of live a normal life and survive without having to worry about that negatively impacting their opportunities.
Well, Dr. Boyle, I really appreciate you being on here today. And what I was going to open it up to, if you could let my audience know what's the best way that they can find out more about yourself and the Holistic Wellness Center.
Yeah, we're a clinic in Fort Mill, South Carolina, right next to Charlotte. And we see patients from all over the world. So we can do everything electronically. And our telephone number is 704-308-2557. And you can go to our Facebook page, the Holistic Wellness Center of the Carolinas, and see all of our hundreds of 5-star reviews of all the patients we've helped.
And also, I believe your website is www.holisticcharlotte.com.
It is correct.
And all of this, for my audience, all of this will be also posted on the website with this video, or this audio, I should say. Again, Dr. Boyle, thank you so much for taking the time with me today and giving us some really good information here that I believe my audience will find fascinating.
I appreciate the opportunity again, and I hope I said something that can help, and I wish everyone the best.
That concludes this podcast. Please leave me a comment or question below. That gives me good direction where to go on future podcasts. I would love to hear your invisible wheelchair stories if you're willing to share it. If you would, go to invisiblewheelchair.com and click on Tell Your Story. I want to remind you that OCD, obsessive compulsive disorder, is treatable, and I can help you get past OCD. So if you have heard this podcast and others, and you feel like you need further assistance and would like to spend some time with me working through any issues you have, then feel free to book a session at focusedhealthyfamily.com or familyocd.com. Or you can call me at 704-562-1630. I also offer $85 off initial discovery session if you mention that you heard it on this podcast. Finally, don't forget that there is a tapping recording that coincides with this podcast you may want to take advantage of. I hope you have enjoyed this podcast and will join me for the next one. Remember to keep tapping, talking, and transcending your life to new heights. Thank you, and have a great day.